Thanks for joining. We're doing this virtually. One reason is, I think, as you all saw in the news, Dr. already had COVID, and so is over it now, but just thought it would be smarter to do this virtually this time around. This chat will be on the record, although honestly, a lot of it is kind of background and just information about how this rollout might happen for this next vaccine. We don't have all of that information yet. We're still gathering information, and there, as you all know, there hasn't been a final decision from the federal government yet. So we are still waiting for that, and we'll have more to say at that point. But just wanted to kind of get together and let Dr. Arwady talk a little bit and then answer questions. We are going to do the raise your hand thing for questions, I think, in the advisory. So we said the chat, but we're going to do the raise hand, which is down at the bottom of your screen where there's a number of icons, and 1, 2, 3, 4, fourth to the right is raise hand. So do that, and then we will call on you and unmute you, and you can ask your question. I think that's all I've got. So I will now mute myself and hand it over to Dr. Arwady.
All right, thanks, Andy. Let's just make sure folks can see and hear. Okay, let me switch the settings. There we go. Okay.
Yeah, can you, I don't know, Megan, can we unmute the reporters? Or maybe somebody can raise a hand or something. A reporter can raise a hand just so we can confirm you all can hear us. It's a little bit of a weird setup here. I can see the other panelists, but I can't see you all. Okay, Craig is raising his hand.
And I'm just letting you know I can hear you, so maybe the rest of us can too.
Yeah.
Sounds
and you
good.
can see the screen, you can see her presentation pop up there. I think Megan.
Presumably. Okay.
All right. Go
all
ahead.
Right. Yep. Thanks, everybody. So yeah, because I am in days 6 through 10 of my COVID infection, I am feeling fine. Thank you. Appreciate folks' well wishes, but I am being just super careful with the masking and didn't want to do a stand up or something, that would have other people involved, but did want to have the opportunity to answer some of your questions and share what we know about this updated COVID-19 vaccine that is coming. This is a big deal. And the timing of it is such that the announcement is likely to come kind of over Labor Day weekend. And I know that for all of you and for all of us, that timing is perhaps not ideal. And so before that happens, wanted to tell you what we expect as well as what we're planning. And we will share these slides after. So if you follow CDPH on social media, we've already started to do some, coming soon after Labor Day, updated COVID-19 vaccines. And these new, what are called bivalent boosters, as you may know already, are targeted specifically toward the Omicron subvariants, the BA4 and the BA5 that are what are circulating right now. It's the first time we've had an updated COVID vaccine since the vaccine rollout. So here's where we are. Step one, in terms of us being able to go ahead with this, happened yesterday. Yesterday, the FDA authorized these what are called bivalent COVID vaccines for use as a booster dose. They authorized both Moderna and Pfizer, and we'll talk about that. So that's step one. These are the booster packages for both Moderna and Pfizer. We've already started doing, the education folks need to know about, you got to store this one frozen and ultra cold and distribute and all of that, but just sharing that these are coming as multi-dose vials. They are only meant for use as booster doses. Step two is happening today. So the FDA has to give it the green light and the CDC has to give it the green light. So the CDC's Advisory Committee on Immunization Practices, the ACIP, meets today to discuss clinical considerations and make recommendations. So for example, we've already been getting the question, if I just had COVID, like me, should I be getting this updated vaccine right away or should I be waiting? We don't have the answer to that yet because the ACIP, these are the kinds of things that they make the recommendation questions and the CDC weighs in on. So there are still a few outstanding questions that we anticipate will be answered with this. So they're meeting today all day, 10 to 5 Eastern. And that is available online if anybody wants to watch. But the vote is at 4:30 Eastern. If they're not ready to vote, though, they've also held tomorrow morning, 10 to 12. So the earliest I think we could see a vote from ACIP is later this afternoon. The latest would be tomorrow midday. So that's step 2. And then step 3 is the CDC director, Dr. Walensky, gives the final approval, vaccine ship. And that could happen as soon as tonight. It could happen over the Labor Day weekend, pending a little bit
Recording in progress.
how the ACIP meetings go. So why do we need an updated COVID vaccine? So this new vaccine is called bivalent, bi like 2. It's a mix of 2 versions of the vaccine. It is both a boost of protection against the original coronavirus strain, as well as newly protecting against BA4 and BA5. More than 95%, and in fact, I'll show you it's now more than 99% of cases in the US, in Chicago, in Illinois, are caused by the BA4 and BA5 subvariants. While the vaccines we've been using all until this point were designed for the original coronavirus strain from 2019, 2020. So this vaccination really could, and I expect it probably will, begin next week, like right after Labor Day, most likely. It's really different from the boosters that have previously been offered. And I want you to understand that this vaccine gives us a chance to try and get ahead of the virus. It helps us protect individuals from the variant that is currently circulating in the US. My biggest worry was, once there was a decision to make an updated COVID vaccine, my biggest worry was that by the time an updated vaccine was available, we wouldn't still be at BA4 or BA5. We'd be on to BA9 or BA10 or some completely different variant, and we wouldn't see a really good match. This is the best possible match. And so we very much are going to want people to get this updated vaccine now, not to wait 3 and 4 months, but right now is when there is a beautiful match against the circulating strains. And it's kind of like every year we make a flu vaccine. The flu vaccine is made based on the scientists' best guess of which strains or variants of flu are circulating. And the flu vaccine performs differently each year based on how good the match is. That's what you'll hear us say. If it's a year that there's a very good match, the vaccine strains that we've chosen to make that year's flu vaccine are a really good protection. If it's not a very good match, it means one of the strains of flu isn't covered as well, and we see more breakthrough flu infections. So this is the same idea. The match couldn't be better, and really are hopeful that people will choose to get this vaccine. So here's the really good news. Everything is still Omicron, and it's nearly all BA4, BA5. So this is across the whole Midwest. You can see this is through really this week. 99.7% of all of the COVID strains are either BA4 or BA5. There's just 0.3% that are still one of those old BA2s. That's amazing for this vaccine. Match couldn't be better. And across the US, it's the same thing. So the dark green is the BA5, the blues are the BA4, and across the whole country, 99.8% right now are BA4 or BA5. So why do we need this vaccine? We know that the original boosters, the original vaccines and boosters were providing great protection against hospitalization and death for Chicagoans. If you follow along on Facebook, these are available at chicago.gov/COVID-. We update them every week. And just on the left, these are COVID hospitalizations just in Chicagoans, and on the right are COVID deaths just in Chicagoans. And every single week we update, and you see here that the red line are unvaccinated Chicagoans. And you can see that huge spike in January, where the great majority of people getting hospitalized and dying disproportionately were those who were unvaccinated. But then the light blue are those who were fully vaccinated, and the dark blue are those who are boosted. So you see that getting boosted also had significant improvement for protecting against hospitalization and especially death. Even in the worst of the early Omicron surge, you see that those who were boosted had really very low rates of death. And so since the Omicron variant became dominant in Chicago, unvaccinated people have been more than 3 times as likely to be hospitalized and almost 6 times as likely to die as those who have been boosted. So getting an updated COVID vaccine gives you an additional boost. It will definitely help for continue to grow that protection against hospitalization and death. But we are also hopeful that it will have significant improvement against some of these breakthrough infections as well. So where you look by age group, and you can go on the website if you want to sort this out by different age groups or other, especially for people over 65, you see how significant that risk is for unvaccinated versus vaccinated versus boosted. And the older you get, the more of a thing this is. So especially for people who are older, have underlying conditions, they're the most important to get this updated vaccine. But if more people can get the updated vaccine, the hope is that that also will decrease the risk of as much infection right now, which in turn will decrease the risk for future variants is the hope. So I just wanted to share a very little bit of some of the science here. And if folks have questions, I'm happy to answer it. The first, back in June, both Moderna and Pfizer presented data to the FDA, human data, with the first version of the bivalent vaccine that they had made. That was a combination of the original as well as BA.1, the earliest versions of Omicron. And the safety data was excellent. These were studies of hundreds of adults. And the safety data was really good. Didn't see any problems, anything different in terms of side effects from what we've seen with vaccines all along. And the efficacy data was also quite good. However, the decision was made at that time not to give a green light to the BA.1 because the virus was mutating so quickly. And they went and said, nope, tweak it a little bit, come back, get one that protects against BA.4 and 5. And so the vaccine that is now being authorized, or that just got emergency use authorization yesterday, is a tweaked version of that one that went through the trials back in June. This is a preprint, so I've got the reference down on the bottom if you want to look it up. I expect it'll get formally published soon. But the reason I put it up here is it pulls together 8 different studies that were comparing how well did original vaccine versus ancestral is what we call it, if it's a version of a vaccine against the ancestral, the Wuhan version, versus a vaccine that was made for a variant. And so whether these were versions of vaccines that were made for Beta or Delta or Omicron, this meta-analysis pulled together how much more effective were vaccines that had been changed to better protect against the way that the spikes have changed. BA.4 and BA.5 have the same kind of spike. And so what you see here is the higher these little boxes are, the better. Higher means that this shows how much more of an increase do you have basically in the antibodies. And so we know when people get a booster, they get about an 11-fold increase in their antibodies, in their level of protection. And so this on the left shows that whereas an ancestral strain it gives, 1 is sort of considered like that is how much protection. It would be an 11-fold increase, but it's a one-time increase. When you give a variant, a version of the vaccine against a variant, instead the average is 1.5, meaning about a 50% higher level of antibody protection when you've got a vaccine that is a better match to the variant. And then on the right, the difference is, are you testing the vaccine against, for example, this is made for BA.4/5 and you test it against BA.4/5, which is on the left, that match vaccine. It's about 75% higher versus a non-matched, which is when you've got an updated vaccine, but maybe you're giving it against an earlier version of Omicron. And so the idea is the reason the decision was made to do, the expense to do an updated vaccine was that the protection in humans is expected to be quite a bit higher And the better the match, the higher it is. And so this is just some of the information that the advisory panels to the FDA were looking at. So here's what we know so far. I've got to put a little caveat. It's possible anything could change with the ACIP recommendations, but I don't expect it. So who can get this updated COVID vaccine, the bivalent booster? Anyone who has completed their primary vaccine series, meaning way back in the day or recently, if it's been 2 months, they've gotten 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of J&J. And it does need to be a booster because the dose here is a little lower, and you've got to get the original version of the full protection before you can get the booster. So that is important for people to know. Does it matter whether I got a booster in the past? No. As long as you received a primary series, you are eligible for an updated COVID vaccine. So if you're somebody who got your last booster 3 months ago, you're eligible and recommended. If you're someone who never got a booster, you're eligible and recommended. When can I receive my updated COVID vaccine? At least 2 months after receiving your most recent vaccine. So if it's been 2 months since you either finished your primary series or got any of that older booster, you are good to go. If you just got a booster 2 weeks ago, you should wait 2 months. Are there age limits? The Pfizer updated booster has been authorized, gotten emergency use authorization for anybody over the age of 12, and Moderna for anybody over the age of 18. That is based on the original trials that were done of the Omicron BA1 from the companies. There may be an updated booster for younger children in the future. That is not imminent or on the horizon. The dosage in terms of the total amount is the same as prior boosters, but it's now split between the two types of protection. So Pfizer is a 30 microgram dose, Moderna is a 50 microgram dose, unchanged. When will it ship? So because we've got EUA approval from FDA, technically shipping can start. We saw ancillary supplies already start to ship, and I wouldn't be surprised if we start to see some vaccine shipping even now. We don't want vaccine arriving on Labor Day or over the weekend, so I think most likely it will be arriving on the Tuesday after Labor Day. We do need CDC and ACI approval to be able to start administering. So the earliest we could be possibly administering would be Tuesday, 9/5, but again, a few things still in the air. Can I still get the original booster? Actually, no. With this new authorization, the monovalent, meaning the old version, are not authorized anymore as booster doses. We really want folks to get these updated. So anybody over the age of 12 who's looking for a booster, this is the one that they're going to get. Individuals 5 to 11 can still get the original booster dose. Will it still be free? We've been getting a lot of questions about this. Thankfully, yes. The federal government is providing this vaccine, is providing the needles and the materials that are needed with it. There is no government issued ID or insurance to receive this updated vaccine. My assumption is this is probably the last version of a COVID vaccine that will exist outside of regular insurance approvals, et cetera, just because there hasn't been additional funding allocated. But I was very pleased that this is remaining entirely free to consumers. And we have not received additional new funding for rollout, but we are using our regular federal immunization funding, tying it to what we do for flu, et cetera, and happy to answer questions if you have it. So let's talk Chicago. Given that we are expecting anyone over the age of 12 who has completed their primary series to be eligible for this vaccine, that means about 1.8 million Chicagoans would be eligible. About 77% of the age 12 and up population in Chicago have completed their primary series. So that's how many, that's our universe of who could get this, this vaccine. If we look by age here, you see this is just right off our dashboard. So the left are the percentage of Chicagoans of different age groups that have completed at least a first dose. That middle are those who have completed a primary series, and the right are those who have previously received a booster or additional dose. So we're it's that middle group, those who have completed their primary series. So you can see, for example, those in their 50s, 87% of Chicagoans are eligible for and should get this updated vaccine, as compared to 73% of 12 to 17-year-olds. So in terms of the Chicago vaccine allotment, we have already been enrolling and setting up for initial distribution healthcare providers that serve higher risk patients and priority providers. We are hearing there will not be prioritization recommended at the federal level. So we're not going to be doing this only people over 65, only people over 50. Obviously, the groups of highest concern are older Chicagoans. So we are prioritizing making sure people in long-term care, people in hospitals, people getting cancer care, senior centers, et cetera, are getting vaccine first. But we are expecting that everybody over the age of 12 will be eligible from the initial rollout. This is partly because the federal government nationwide has told us they anticipate being able to ship about 20 times more vaccine per week than they could in the initial vaccine rollout. So we are anticipating enough vaccine. And again, we've been using numbers here to kind of plan. So this is our initial rollout of the vaccine when demand was highest. And you can see at the peak there in early April, we were averaging about 18,000 doses a day. Earlier around 9,000, you get a sense of sort of what that's been. And so based on previous demand, we feel confident that our allotment is going to meet the upcoming demand. For the first few weeks, it could be a little stretched. Again, we'll be prioritizing the highest risk populations in terms of where we distribute vaccine, but it will be open to everybody over the age of 12. And the feds have said that after the initial allotment, really every week, they're ready to ship more vaccine as we show that we use it. So the city of Chicago has been allocated approximately 150,000 doses of the updated vaccine from the federal government to be shipped up in approximately the first week, probably in two different sort of allotments, but then with more following really quite quickly as needed. So we're expecting those 150,000 doses to go pretty wide, and that's what I want to give you a sense of. We're expecting 90 retail pharmacies to receive vaccine in the first week across the whole city. The CDPH does not control where the pharmacy allotment goes, but we've been in conversations with Walgreens, CVS, et cetera, of course, in parts of the city that have fewer pharmacies, making sure that there's enough vaccine in those settings, et cetera. There are also about 25 healthcare facilities, especially hospitals, that will get it right away at the beginning. Remember, we want to make sure the highest risk people are getting it first, and then additional CDPH locations will be adding more healthcare facilities each week. Pharmacies remain the #1 way that Chicagoans and Americans have received COVID vaccines, including boosters. So we wanted to make sure from the beginning those were available. And we are, of course, following the data. We are prioritizing access for those with more limited access to vaccines. So for example, our Protect Chicago at Home program, which brings vaccine Saturdays, Sundays, Mondays, and Tuesdays right now, morning, afternoon, evening, we'll bring it to your home. Right at the beginning, we will be prioritizing that for Chicagoans who are over 65 or homebound and live anywhere in the city, as well as anyone who lives in the priority zip codes where we still see vaccine lagging or where access may not be as good. As I said, we're already focused right at the beginning on long-term care facilities, senior centers, planning, shelter, jail, et cetera. We've already started provider trainings, more of those to come, and we will be, in terms of messaging, we'll be combining our flu and this updated COVID vaccine media campaign, again, just given some somewhat limited funding for a lot of advertising with rollout. So in terms of numbers here, about in the very first allotment, about 46% are going to retail pharmacies, about 1% are separately going to federal sites, whether that's the VA or some of the federally qualified health centers, and then about 53% to other sites across Chicago. So I think I pretty much went over this. The congregate settings, we're working with CHA. We've got things planned at every DFSS senior center. We've worked to make sure that CPS is getting vaccine directly through its contracted vaccine provider. And we will be standing up some larger clinics, our family vaccination clinics at city colleges. We'll be offering the bivalent, the new updated COVID vaccine. We will be offering the original COVID vaccine for anybody who's just now deciding to get vaccinated. We will also be offering the flu vaccine, so people can get both of those free of charge. And we will, because it's been very successful all along, be doing Saturday city colleges. We are tentatively planning our first large clinic where we can do, 800 people, for example, probably at Olive Harvey, Saturday, September 10th, within that first week and weekly thereafter. We are working with the aldermen. We are making sure there's going to be at least one vaccine location and date in every ward. And these are just some of the initial preliminary maps. I wanted to give you a sense of this. We'll be posting these formally on the website once we've got the approval. But you can see on the left, what we call pre-positioning, where there have already been sort of the very first appointments or the very first vaccines ordered. The purple are the pharmacies. You see there are more of them, for example, in the Loop and on the north side. Again, CDPH doesn't control that pharmacy strain. That pharmacy stream, but we've worked to make sure that the ones, especially on the south side, have adequate vaccine available, and then we'll be working to fill in where there are fewer bricks and mortar sites right at the beginning. So you see the pink are the healthcare sites. Again, this is especially hospitals. This doesn't include every single site that will be offering it. So long-term cares, for example, vaccine will be coming to them through pharmacy partners, but they're not shown here because they wouldn't be open to, open to the public. And then on the right is giving you a little sense of the geographic distribution of some of the larger things where we already have sites planned. So added on to that are the aldermanic sites that are already planned in green, the DFSS senior sites in red. We're starting those actually next week. And then the family vaccination clinics, which are the city colleges. We'll also be supplementing this with places that we've seen really good uptake. Things like Swaparama has been really good for Latinx uptake. And so we're looking at our data, and wherever we've seen good uptake, especially with boosters, we will be continuing that with a special focus on Black and Latinx Chicagoans who continue to sort of bear the brunt of poor COVID outcomes. We are anticipating some disparities, and I want to just talk about that so we can answer your questions. About 77% of those over 12 completed that primary series, but only about 44% have gotten their original booster dose. And I think where we look at national surveys, the concern is that it may be even lower. I'm hoping not, because this really is a better vaccine, but we will be aiming to get that number as high as we can. And racial and ethnic disparities remain a focus. This is off of our dashboards. You can go back and explore it, but I just wanted to emphasize that one of our biggest challenges here is that by different age groups, we see pretty different race and ethnicity uptake, even though there's been a lot of work. And so, for example, this is 12 to 17-year-olds. Again, you have to have completed the primary series to get this booster. And so if we look in 12 to 17-year-olds, 86% of Asian, non-Latinx Chicagoans have completed that primary series, 77% of Latinx Chicagoans, 76% of white Chicagoans, but only 51% of Black Chicagoans. And so there's a smaller pool that would be at least initially eligible. So we'll also be encouraging people to, get those first doses now if they have not. And then if you just go by the age 18 to 29-year-olds, you see that difference persists, higher Latinx, highest Asian, next highest Latinx coverage, followed by white, followed by Black. This is 30 to 49-year-olds. This is 50 to 64-year-olds. And once we get older, this is where we want to see those numbers get as close to 100% as we possibly can, and then those over 65. So I encourage you to explore. But we know, for example, that at home has been a very popular way for Black Chicagoans to get vaccinated, which is why we'll be prioritizing appointments for some of the predominantly Black zip codes or the less vaccinated zip codes. So we will be updating this once the new vaccine gets the green light. The zip codes down on the bottom right there are the zip codes where we've been prioritizing incentives. Those are the ones we'll continue to sort of prioritize for appointments. We still will be vaccinating up to 10 people. So as long as there's one person who is, for example, over 65, we're happy to give updated vaccine to the whole family over 12. But we are going strong with at home because it's continued to be a strong program for us. So this is also continuing 7 days a week, 312-746-4835. And we will be updating our website as well as releasing a formal press release once the CDC has given it the green light. We may do a stand-up next week, depending a little bit where this happens, but just appreciate all of your attention. Happy to take any questions. Just want to very much make sure that all of you have a good understanding of this because it's a big deal. And we don't have all of the resources that we have had previously to lift up all of the, lift it all up as much, I think, with media campaigns. I'll stop sharing and happy to take questions. Thank you.